Yeah, okay. Later, man.
Welcome to the Happy Brain Concussion Care webcast. I'm Dr. Todd Turnbull. Today we're going to talk about brain injuries and concussions, and I'm going to take you to the internet with me, and what we're going to do is open up a web page. Excellent. happybraincheckup.com. And what I'm going to do is take you through our website and through the training materials that I have available for you in the trauma-free treatment protocols. These are protocols that are used to manually manipulate brain-injured patients in a very gentle way to reduce concussion signs and symptoms. And for people who are interested in becoming certified providers, this is where the training materials are. So I'm going to have everybody in the world has access to these training materials so you can see the treatment protocols and evaluation protocols for concussions. So at happybraincheckup.com, this is the home page, and as you can see on here, it's got on the top bar, it says home, and then it says free Happy Brain membership, and then there's a login page. So you can go to the free Happy Brain membership, sign up sheet, and create your own login page there. If we scroll down on this page, you can see you can begin concussion screening on here and highlight this, and this is going to bring up a concussion screening form, which will then allow you to evaluate yourself or to evaluate somebody else who may have possibly had a concussion. And so what we're going to do is look at this form. This is the concussion screening form, and it says do not perform if you have any of the following: recent head or neck injury. So if somebody's recently been injured and they've had a head or neck injury, they've had a concussion, you don't really have to test them. Now, if you want to test them to evaluate what level of concussion they have or how severe it is, this is one thing you can do. And if they've got a head or neck injury, we just want to see what their mobility is before we do any testing. So we want to gently see, can they turn left and right? And if they can't, we don't want to have them do this test. Also, if they have a headache, if they're dizzy, those are already signs of concussions, and we don't want to have them perform this test. If they're having a cold or flu, that may impact the results of this test. If there's sinus infection going on or infection of the ears, nose, throat, that's probably going to also impact the findings. And if there's an eye condition, if there's an infection or some dysfunction in vision already going on, that's going to alter the findings of this test. And what we're looking for with this test is any twitching of the eyes, where they do this rapid movement. That's called nystagmus. We also want to look for, as the patient does this evaluation, which is they're going to be rotating their head a couple times and then coming back to center to focus. And so we're looking to see if they have a loss of balance, and it looks kind of like this, that there's a little bit of a wobble. If there is a delay in their visual focus, like kind of looks like if somebody's been drinking and they can't quite focus on who they're talking to. And then also if doing this evaluation creates any dizziness or headache or nausea, those are things that all we want to note and observe as positive findings for concussion, potential of having a brain injury currently going on. This test can be used for both acute and chronic patients. And so what we do with the evaluation procedure, while the person is seated, we're going to have them focus their eyes on an object about 2 to 3 feet away. And then we're going to have them horizontally rotate their head fully 2 times, again, pain-free. So we're just going to evaluate how far can you turn your head to one side without pain, how far can you turn to the other side without pain. Great, no problem, then let's proceed. And we're going to have them rotate their head at 1 rotation per second. If you look down at the bottom of this, it says grade 1 is 1 rotation per second. And it looks like this. 1, 2, 3, 4, stop, look at the focus, look for any loss of balance or a delay in recovering their balance, a delay in their focus. If you do that and there's a loss of balance still going on or a delay in the focus, you don't need to test that person any further. That confirms that there's something that's not functioning properly in the nervous system, either in the eyes, in the ears and balance, or in the brain, in the central brain. We should easily be able to do, every healthy human should be able to do that rotation at 1 rotation per second without having a loss of balance or visual dysfunction, visual focus challenge. If they're great with that, we can go to grade 2, which is 2 rotations per second. And so that would look more like a 1, 2, and back to focus. And then moving on to grade 3 is 4 rotations per second, and a grade 4 is 6+ rotations per second, or as fast as they can shake their head. If you think about little children when they shake their head really fast to try and make themselves a little dizzy, that's kind of what we're looking to do and seeing what reaction is there. A normal, healthy human has the potential to rotate their head at 6+ rotations per second without a loss of balance or a delay in their visual focus, and that's what we're looking for. So how will you know if your concussion is better? This is one of the monitors I use for myself and for my patients. Once you see that the person is having these reactions at a grade 1, grade 2, or grade 3, stop. Do not proceed any further. And this is a form that you can fill out here for those who are training to be concussion evaluators. This is the grade, the format that can be used to evaluate and determine where the person is at today and their progress through their concussion. How will you know when your concussion's better? You'll be able to rotate your head quickly without having a loss of balance or delay in visual focus. Okay, so that's what the concussion screening is, and now we're going to move back into the main screen on the Happy Brain Concussion Care, the happybraincheckup.com website. So this is still the home page. There's the concussion screening form. If you haven't logged in and become a member, do that now. It's free, and that will give you access to all the training materials. On here, front page talks about the Happy Brain program is a neuromuscular-based approach to evaluation and treatment of concussed patients. Neurological dysfunction is objectively identified and manually manipulated with the trauma-free treatment protocols to address concussion signs and symptoms. So we evaluate the patient for what signs are there of concussions and what symptoms are there, and then we apply the treatment protocols. And we want to do the evaluation so we have a baseline to see where that patient is at, what dysfunctions are present, so that as we apply the treatment, we should see that those symptoms and those signs dissipate or diminish. Okay, so if you haven't already joined up, we're going to go ahead and have you join up. Again, here's more of the concussion screening form. And then there's also a concussion symptom survey. And on the concussion symptom survey, what we can get, see if I get my button to work here. And this is the Rivermead Post-Concussion Symptoms Survey. And so there's a great form that I love using to evaluate patients at any level, whether acute or chronic concussion, to see exactly where they're at. And there are 13 questions on here. excuse me, that 13 questions on here that evaluate concussions, and you can put a different scale on here whether the problem is severe, moderate, mild, or not a problem anymore. And then the first 3 questions are in the physical realm. Physical signs of concussions: headaches, dizziness, nausea, or vomiting. The rest of these are symptoms. There's noise and light sensitivity, fatigue, irritability, depression, frustration, forgetfulness, and you can see the rest of those are vision and restlessness. And then what you do with this form, as they fill it out, there's also space for them to fill out additional difficulties in here. And one of the other difficulties that I tend to include or will ask the patient about is brain fog. And so that's something we can also monitor for patients. And brain fog I describe as like a cloud, like over your head. It might be over in front of your face, or like like when you have a lot of sinus pressure build up, that kind of fog that's in here. And so that's something I have patients look at, discovering, is that mild, moderate, severe, or present for you at all. And then what we can do is take these numbers and add them together and come up with a score, and then see what the patient is, at what level they're at as far as mild, moderate, severe in their concussion symptoms. What I don't have on this page is the scoring system on this. And out of 13 questions with a total of 4 points at each, the higher the score, the more severe the concussion. And what I will do is include the scoring system along with this so that you can evaluate that yourself. Okay, going back to the main page. And again, if you have not already joined and become a member, a free member, it's available right here. If you're already a member, we're going to log in. And let's log it. And then I'm going to put in my information in here. Bear with me while I work on entering my password. Good. And so as you have go into here in the membership, on the top bar you can see, you can go back to home. Under your Happy Brain membership, you can see your account, which is this page, and then you can see there's a highlight of Happy Brain Concussion Care. We're going to come back to that because that's where all the material is included. Real quick, we're just going to look at your account. You're on the dashboard here. You can look at orders, your membership, downloads, account details, and log out. So, under your membership, we're going to go down here under Happy Brain Concussion Care, and this is the access to all of the material that I have available on concussion evaluation and treatment protocols for those of you looking to become a certified provider. You're a healthcare provider and you want to apply treatment and be certified in this program. This is where you would find the training materials. So again, the Happy Brain program is a neuromuscular-based approach to evaluation and treatment of concussed patients. Neurological dysfunction is objectively identified and manually manipulated using trauma-free treatment protocols. This program is a network of providers, and we are creating the provider page. We're doing marketing to promote to patients, to companies, large companies such as Lowe's and Home Depot. We are having communication with them and looking to approach them with this program. As we approach these corporations and different companies, sports, athletics, etc., different venues and areas of patient populations who suffer from brain injuries, and patients who are going to be looking for providers who have this type of training. Because patients are looking for answers to treat their brain injuries, to treat the symptoms that they're living with, and to deal with those signs that are there for them. And so these are treatment protocols that I have developed to deal with my own concussions. I've had numerous concussions through martial arts and snowboarding and hockey, and numerous car accidents, and baseball bat to the head as a child at 5 years old, and some other stories like that. So looking here, we have a resource materials right here, and here are the trauma-free treatment protocols. You can highlight that and pull that up. The VESS exam card is the Visual Error Scoring System exam card. It is the visual evaluation tool that I use to evaluate concussions, to look and see exactly what patients are dealing with in visual dysfunction. And as we look at their eyes and look for any nystagmus or eye twitching, if we look for the loss of balance, the symptom aggravation, the dizziness that may be associated with testing brain function, and specifically eye exam here. One of the things about looking at the eyes with brain injuries, the eyes are connected to over half of the brain. So if there's an injury anywhere in the brain, it's going to show up in the eyes and the eye function. And then there's a video here of the visual error scoring system, as well as a training video, so you can see one of my patients who's got a severe brain injury and her reaction to doing the head shake and to doing some of the concussion evaluation, where we test for brain injury and test cranial nerves. And I'm going to go through some of that here with you in a little bit today too. Post-concussion exercise is, again, another article I've written here. And in the Happy Brain exam, this is the exam format that you can use to evaluate patients. For those of you who'd like to be certified, down here we've got the different, here's a list of the different ways that we test and evaluate the cranial nerves, doing balance testing, jaw function testing, cranial nerve testing. Again, access to the trauma-free treatment protocols, and then a description of the course objectives over here on the right-hand side. And what we cover in the training course here is pathophysiology of concussions, diagnosis and prognosis of a concussion, red flags that we want to look at, things that come up that are signs that of a progressive brain injury, things that we want to send the patient directly to the emergency room for further evaluation for imaging of their brain. That would be the red flags. Health concerns of pediatric patients. Looking at diagnostic tests to use, and then also the trauma-free treatment protocols, the half somersault maneuver to help patients with vertigo, and then ways that we can address cranial nerve lesions. These are all in the training program here. This is the training program. And then there's a video here of me doing concussion testing. Again, this is my patient who has had severe brain injury, and you can see the result of her testing when we do on there, and where you can see dysfunctions in what's going on with her. And then certification, for those of you who apply for certification, you can register through here to become certified providers. And to be a certified provider, what that means is you're going to go through the training program down here. And on here, we've got the seminar notes that you can download, and then there's audio to go with those seminars notes. And there's 3 hours. And then there is the test, which is right here. You can print the test out, complete your test, submit that for testing. And then further certification, you're going to take the trauma-free treatment protocols. You will videotape yourself performing those and send those videos to us, as well as a model release form. And after review of the videos, what we see that works and meets standards will be passed. What doesn't meet standards, we will then take and ask you to repeat or redo the video using more appropriate and more effective procedures. And when you complete that, then you get your certification. Because this is a 3-hour training program, for those of you looking for continuing education credits, we are applying for continuing education credits, and we have continuing education credits for some of you already. So feel free to ask us about that. And what I'm going to go do is go back up to the top of the page here. Again, this is the happybraincheckup.com website, and if you haven't applied for your free membership here, apply for that, and then join us on the Happy Brain Concussion Care page, which is what we're looking at here. This is the training program for those looking to be certified. And what we're going to look at right now is the trauma-free treatment protocols. So we're going to go to resource materials, and we're going to highlight this page. And what this is bringing up is the trauma-free treatment protocols. These are the protocols that I have developed to deal with my brain injuries. And I've had numerous brain injuries, which is kind of humorous because it might explain for some of you why I am the way I am. But these trauma-free treatment protocols address concussion signs and symptoms. And they're a set of neuromuscular manipulation procedures. Some of these you can apply directly to yourself. You can train the patient to do for themselves. And really amazing results. It's what I use to fix my own brain injuries. And I wish I could do all of these procedures to myself. So the treatment outcomes are that cranial nerve dysfunction is improved or restored to normal. And craniocervical muscle tension is reduced. And so we're talking about the muscles along the base of your skull back in here. We want to have those reduced because that creates a lot of excess tension in through there. And are we getting any messages, any live content? Can we see? Do you want to pull up the other? See if we can do something like that. What's that? Try it and see what we have coming up. Yeah. Okay. And symptomatology being reduced on our assessment forms. That's that post-concussion symptom survey form. If we do that on day 1, and then using the trauma-free treatment protocols, what I request initially of a patient is, let's start with 5 visits. And in 5 visits, I expect to have a significant impact on the patient's signs and symptoms. And so we do the post-concussion symptom survey on day 1. We do the visual error scoring system on day 1. We do the Happy Brain exam. And so on there we can see where the patient's at, and then on each visit we can see how they're progressing and the results of our treatment. And so we want to see these come into place. The DHI is the Dizziness Handicap Inventory. I will also include that. Are you saying yes, we have responses? There's no response. So if anybody is out there and has questions, please feel free to share. Would love to answer some questions, and thank you all for being here and attending. And then there are other assessment forms that we may want to use or look at, and if you have some questions about any of those, I'm willing to hear and listen to that. We do heart rate variability here in my clinic as one of the evaluation forms as well. Okay, and so effectiveness of treatment application is evaluated by physiological response. What we're looking for is the patient to go, oh, an exhale of relief or a sigh. And we also want to hear them say, wow, that feels really good. Can you keep doing that? That's how one of the ways we're monitoring the effectiveness of our treatment. Have John send a text in or respond. Okay, just so we know that that function is working for us. Okay, so occipital traction, seated. The design here is to reduce tension in the trapezius muscles and the suboccipital and correct that suboccipital tension. And so what we're going to do is we're going to cradle and lift the occiput up and away from the first cervical. And as we do this, we're just going to go lift and hold that for about 3 to 5 seconds. Allow that patient to have that release of tension and breathe and just let go of tension as we're creating traction. So we can do this from behind the patient, as you see the picture on the left, and then we can do that from in front of the patient. And we want to try and use minimal pressure on their cheek and jaw, most of this being on their occiput and base of their skull. And then as we're doing that elevation and creating that traction, and if you can see me on the video screen, I'm lifting up, what we can do is do a little lateral tilt, nice and slow, about 5 degrees to each side. As we can also do some rotation, and we can do a little flexion and extension. And we're just looking to find ways to allow that patient to release tension in those suboccipital muscles and the trapezius muscles going down into the shoulders. Okay, occipital traction, supine. This is with the patient laying on their back. And what we're going to do is we're going to take the bottom hand and cradle the occiput. Typically I use my thumb and my middle finger to cradle the occiput here. And then my other hand is going to come in and support under the jaw. If you're looking at the video or the picture here on the screen, you'll see that there's a large arrow under the base of the skull and a small arrow under the chin. That means I'm using most of the force through the bottom hand and minimal amount through under the chin. And then I'm going to pull the occiput away from the first and second cervical, and I'm going to use a gentle traction. So I'm just going to pull, allow that tension to release, and then I might release it slowly and then pull again, and release it and pull again and hold. And then while I'm holding it, I can also do a little bit of lateral movement, a little bit of rotation, again about 5 degrees, nice and slow. If I'm doing this really fast, I'm going to shake and move that patient's brain, and if they've got a concussion, they've got brain injury, I'm going to be irritating their brain, I'm going to be aggravating their symptoms. And so this is why I constantly am checking in with the patient while I'm applying these treatments. What does this feel like? Because if they go, wow, that's making me nauseous, or it's making me dizzy. Okay, stop. I'm going to stop right there, and I'm going to do something different. I'm not going to keep repeating what I'm doing. You don't want to be doing things that are going to be aggravating the patient. Great. And did we get a response? Did he send it?
It's good.
Okay.
I have a question, but we'll pass it.
Okay, got it. Okay. So occipital nodding, this is where we're going to have the patient laying, again, supine. There's going to be, my hand is going to be under the base of the occiput, again, cradled with my thumb and my middle finger. And then I'm going to take, my other hand is going to be up on their forehead. And if you're looking at the picture here, you'll see my fingers are pointing out over her eyes and her nose. This is not how I do this in reality, because I do not, if you're looking at me on the video, I don't want my fingers down in her face, so I turn my hand actually sideways so that I'm into the, coming into here as I'm applying that force down. So I'm not taking it down here where this is all in the face. Good. Okay. And then we're looking at, good. So what I do is I'm doing this nodding motion. So what I do, the bottom hand keeps traction, constant traction, pull. And then what I do is I flex the chin down and I release. I flex the chin down, I release. I do not add any extension with this move. Any extension I do here, if I'm going from flexion to extension, I'm going to irritate and aggravate all kinds of concussion symptoms. That patient is not going to be happy with their treatment. They're probably going to get nauseous. They're definitely going to have some irritation going on. Do not take this into extension. This is all flex, release, flex, release. And I will also be putting on this website video clips of me performing each of these techniques so that you can actually just look at each clip and just touch it, and you'll see it'll be a looping video clip and you can see how that's done and performed. Okay, the A2P Cranial Compression. As you see, I'm performing to myself. My one hand is on the forehead, the other hand at the base of the skull, and I'm squeezing together, applying pressure. And I apply this pressure for about 3 to 5 seconds, maybe less than that, but I'm applying enough pressure and force that it feels good, it releases tension. Doing this to yourself can feel okay and feel good. Having this applied to you by somebody else can feel amazing, and that's what we're looking for. So when I apply this to a patient, I'm looking for that patient to really have a response of that feels really good. So this is where I'm constantly checking in with the patient. How is my pressure? Would you like more pressure? Would you like less pressure? How's my contact point in the front? Is that irritating? Is that uncomfortable? No, that's fine. How is the contact point in the back of the head? Is that okay? Yeah, it's a little irritating there. Great, let's move it down a little lower. How is that? Yeah, that's really good. And I also want to have the patient do a slight flexion. So if you come in and you find that, and by the way, if you're doing this, applying this to the patient, you want their head about your chest level. If it's higher than chest level, your hand pressure isn't going to quite be as powerful and effective. So ideally we want to have them seated so that we can come in, head is about chest level, and then we're going to apply pressure front to back for them. And when I put my hands on there, I want to have that from their forehead to the external occipital protuberance, which is that knob at the base of your skull. And what I want to do is have that in an alignment that's almost level, almost perfectly horizontal. And so that usually requires that the patient has about a 5-degree flexion of the head. And then from there, that's where I'll go ahead and apply that squeeze. One of the other things you can do to help apply some of that pressure for yourself, and I tell patients, is you can take like a robe or a belt and you can loop it around your head, and then you can go to squeeze and release, which is great for reducing pressure in your sinuses. But the results of this for patients with brain injuries and for myself having concussions is amazing. It totally allows a release of pressure in the brain and brainstem, and the result is a reduction of brain fog, dizziness, nausea, and vision. What I hear quite often with this is patients go, wow, the room just got brighter, colors got clearer, reading becomes more clear. So this is one of the #1 techniques that what helped me really discover the power of using these techniques for brain injuries was this initial movement here, and the results patients would respond about how this felt. The temporalis muscle attaches along the upper ridge of the lateral aspect of your skull. And as you see it in this video, or in this picture here, it's attaching from anterior all the way back to posterior skull. And, and then it comes all the way down together and attaches into your jaw muscle. So this muscle is responsible for quite a few different jaw functions and movements. And so anytime there's like a whiplash injury, or like a boxer getting punched to the jaw, or some type of impact landing on the jaw, like coming off of over the handlebars and landing on your jaw face down, those type of impacts straight into the jaw are definitely going to have an impact on the temporalis muscle. The challenge with the temporalis muscle is that it's going to hold that tension in there, and then that keeps pressure on the jaw, keeps irritating not only the nerves in the jaw joint region, but also the nerves coming through the temporalis muscle and the arteries and blood vessels coming through that temporalis area as well. And some of those go directly into the eye. And so working on the temporalis muscle can also have an impact on vision and eye issues as well as headaches and jaw issues, etc. So addressing the temporalis muscle, if you'll see in the picture, what I'm doing is I'm taking my fingers on the side of the skull and I'm going to push them up so that as you see the arrows in the temporalis muscle, we're pushing the muscle back up into its origin where it's being strained out of the origin. We're going to push it up and just hold it and allow it to reconnect into that region. And as I push up, I'm going to take my fingers and I'm going to spread them apart more. And I'm going to go back to live screen here a second so you can see what I'm doing. So I'm going to take my fingers and I'm going to have them kind of in a closed position right above my ear, about 1/2 inch to 2 inches below my line where my occipital muscle attaches. I'm going to take the fingers, and as I push up, I'm going to separate the fingers so that I'm covering as much of that temporalis line as possible. And I'm going to push up into that connecting line and then hold pressure upward on that, allowing that temporalis muscle to release its tension. And as I hold that 3 to 5 seconds, it should feel really great, have a really nice release for what's going on there. Okay. And then this is something you can teach the patient to do to themselves. And by the way, they can do this bilaterally as well. And again, that can reduce issues, headache, brain fog, TMJ issues. So let's talk real quick about where do concussions irritate nerves. That first cervical region is right between the occiput and the first cervical region. We have the vagus nerve, spinal accessory, hypoglossal, auricular, and occipital nerve. All of that goes to say that there's a lot of nerves going right through this region of the first cervical, and this is how we address the first cervical. The contact point is the anterior part of the transverse process, which is this bone. If you're looking at the picture on the right, the first bone under the skull is the first cervical, and we're looking to contact the anterior portion of that, and we're going to drive that posterior. So if you see where my finger is, I'm pushing kind of towards the base of my skull. I'm going to find where it's most tender and the direction that's most tender. So the point of maximum tenderness is the area of most dysfunction, and that's what we're going to find. And when we contact that area, we should notice a alteration of symptoms. If the person has got dizziness or nausea or headache or brain fog or whatever they're dealing with, contact one or both sides, look for what's most tender, hold those, and see what happens with the patient. See what happens to their symptoms. There should be a reduction. We can also, while the patient is holding this, have them flex and extend, laterally flex and rotate both sides. Suboccipital muscles, what I want you to know here is that they're attaching under the base of the skull. We want to push them up into the base of the skull to reduce tension on those. You can also look at the insertion points at the transverse processes of C1 as well as at the spinous process of C2. Look for anything that's tender there. Push those inferiorly, pushing the muscle back into the attachment at the bone. So the rest of this is about the crazy brain stretch, cranial nerve entrapment. We're going to talk about that stuff a little later. What I want to do is go back to our main page. That was the trauma-free treatment protocols. This is the resource materials available. There's the visual error scoring system in here. There's the Happy Brain exam. For those of you interested in becoming a certified provider, you can register here. Here's the training program. I'm going to click open real quick so you can see the seminar notes and what that looks like. And again, this is a slideshow with audio, so you can have the audio there as well as bring up the slideshow. And this is the Happy Brain program, educational training program, concussions, pathophysiology, concussion signs. Signs, these are actual signs that we can document, and when we see these, we know the person has a concussion. Loss of memory, confusion, that blank or vacant look, balance incoordination, motor incoordination, they're stumbling, loss of consciousness, and any visible head or facial injury. Those are all concussion signs. There's not a question whether the person has a concussion. This person has a concussion. The question is how much of it is impacting them and what kind of symptoms do they have. And in concussion symptoms, well, the red flags we want to look for again are bleeding into the brain. Somebody who's unconscious and we can't wake them up. Somebody who's having seizures. If the pupil sizes are different. Headaches that are so severe and they continue to get worse. Vomiting, and if somebody has vomited twice, send them to the hospital. Weakness, numbness, or decreased coordination, slurred speech, degrading awareness or motions, they get emotional and it continues to get worse, or babies or children that just won't eat or won't stop crying. And those are all things we want to send straight to the hospital. And again, this is the notes that we have. Training program, that's the slideshow. There's the test questions at the bottom. And registering through there. Do we have any questions? Is there anybody have anything going on? I want to thank you all for joining our webcast today. If you have any questions, feel free to email me at drtodd@gmail.com. And subscribe to my YouTube channel. I will be doing more. Join us for our next webcast, which will be coming up in January on approximately the 15th. That's already posted on the Facebook page. And I look forward to hearing from you. All right, have a great day. Thank you. I'm going to bring this back to... Thank you. Have an awesome day.